Welcome, and thank you for joining me today. My name is Sarah Becker. I am a family nurse practitioner, and today we're going to explore how we, as an interdisciplinary care team, can reduce avoidable hospitalizations in long-term care setting. This education is part of a quality improvement initiative designed to empower you with knowledge, tools, and strategies that make a real difference in resident outcomes. Reducing avoidable hospitalizations in long-term care settings is a critical issue that affects both the quality of life for residents and the financial sustainability of healthcare systems. Each year, approximately 25% of long-term care residents are hospitalized, often for conditions that could have been managed within the facility. These transfers are not only costly, amounting to an estimated $1.9 billion annually in avoidable expenses according to CMS, but they also pose significant risks to residents. Hospital stays can lead to infections, medication errors, physical decline, and emotional distress, especially for those with cognitive impairments. Moreover, frequent hospitalizations disrupt the continuity of care and can undermine trust between residents, families, and care teams. Let's take a closer look at what's driving avoidable hospitalizations in long-term care settings. These transfers are often triggered by common clinical conditions such as urinary tract infections, dehydration, congestive heart failure, pneumonia, chronic obstructive pulmonary disease. While these conditions are frequently manageable within the facility, they can escalate quickly when early warning signs are being missed. One major contributing factor is delayed recognition. Frontline staff may lack the clinical training needed to identify subtle changes in a resident's condition. High turnover rates further complicate this issue, as staff may not be familiar with residents' baseline behaviors or health status. Additionally, the absence of standardized monitoring tools can result in inconsistent assessments and missed opportunities for early intervention. Communication breakdowns also play a significant role. Inadequate shift handoffs and incomplete documentation can lead to misunderstandings or overlooked symptoms. Without structured communication tools like SBAR, staff may struggle to convey critical information clearly and effectively. Language barriers and hierarchical dynamics within the care team can further inhibit open communication, preventing timely action. Finally, staff perceptions and fear of liability often influence decisions to transfer residents unnecessarily. The inevitable, when in doubt, send them out. When faced with uncertainty, staff may err on the side of caution, opting for hospitalization to avoid potential legal consequences. This is especially true when there's limited confidence in the facility's ability to manage acute changes in condition. By understanding these root causes, we can better target our interventions and support staff in making informed, resident-centered decisions. Now, let's explore the tools and frameworks that can help us reduce avoidable hospitalizations in long-term care. One of the most widely adopted initiatives is the INTERACT program, which stands for Interventions to Reduce Acute Care Transfers. This quality improvement model equips long-term care staff with practical tools to recognize early changes in residents' condition, communicate effectively, and make informed decisions about hospital transfers. A key component of INTERACT is the Stop and Watch tool. This simple checklist empowers non-clinical staff, such as certified nursing assistants, to report those subtle changes in a resident's behavior or condition. Phrases like seems different than usual, or not eating, or sleeping more can be early indicators of a developing issue. By encouraging staff to speak up, stop, and watch, promotes early detection and timely clinical follow-up. Another essential tool is SBAR. This is a structured communication format that helps staff relay clinical concerns clearly and confidently. SBAR stands for Situation, Background, Assessment, and Recommendation. It guides staff through presenting what's happening, the relevant clinical context, their assessment of the issue, and what they suggest should be done. This format improves quality of handoffs and ensures that providers receive the complete and actionable information. The Transfer Decision Support tool is also part of the INTERACT suite. It helps staff evaluate whether a hospital transfer is necessary by considering clinical criteria, the resident's goals of care, and the facility's ability to manage the condition. This structured approach reduces unnecessary emergency room visits and hospitalizations while supporting resident-centered care. In addition, Interact includes care paths for common conditions such as UTIs, CHF, dehydration, and pneumonia. These evidence-based protocols guide staff in managing these conditions safely within the facility, reducing the need for external transfers and improving outcomes. Beyond Interact, advanced care planning plays a vital role in aligning care with resident preferences. Advanced care planning encourages shared decision-making and helps avoid unwanted interventions, especially during acute changes in condition. When residents and families are engaged in these conversations early, care teams can respond more appropriately and confidently. Together, these tools and frameworks create a comprehensive strategy for reducing avoidable hospitalizations and improving the quality of care in long-term care settings. Advanced care planning is a vital component of resident-centered care in long-term care settings. It involves proactive conversations between healthcare providers, residents, and their families about future healthcare decisions. These discussions help ensure that care aligns with the residents' values, goals, and preferences, especially in situations where they might not be able to speak for themselves. Advanced care planning reduces unwanted interventions by clarifying what types of treatments a resident would or would not want, such as hospital transfers, resuscitation, or intensive care. It also encourages shared decision-making, fostering trust and transparency between care teams and families. Facilities that implement advanced care planning effectively see fewer unnecessary hospitalizations and higher satisfaction among residents and families. By integrating advanced care planning into daily practice, we can honor the wishes of those we care for and improve their quality of life. Reducing avoidable hospitalizations is not the responsibility of one provider. It requires a coordinated effort from the entire interdisciplinary care team. This includes physicians, nurse practitioners, nurses, social workers, case managers, and other frontline staff. When each team member understands their role and communicates effectively, care becomes more proactive and resident-centered. Collaborative models, especially those involving MD to NP partnerships, have shown measurable success. Facilities using these models have experienced up to 23% fewer hospitalization. This is largely due to improved availability for on-site assessments, timely interventions, and shared care planning. Interdisciplinary teamwork also helps reduce care fragmentation, especially during transitions. When providers co-manage high-risk residents using shared goals and documentation, outcomes improve and unnecessary transfers decrease. Building a culture of collaboration is essential to sustaining these improvements and ensuring residents receive the right care in the right place at the right time. Reducing avoidable hospitalizations starts with empowering staff to take proactive, informal steps in their daily practice. One of the most effective tools is Stop and Watch, which supports the early identification of changes in residents' conditions. This tool is invaluable for frontline staff like CNAs, who often notice those subtle shifts in behavior and health. Encouraging consistent use of Stop and Watch ensures that these observations are communicated and acted upon promptly. To reinforce its use, facilities can post laminated copies in staff areas and incorporate it into shift handoff routines. Effective communication is another cornerstone of quality of care. The SBAR format provides a structured way for staff to communicate clinical concerns to providers. Training all team members on SBAR and integrating it into documentation systems, whether electronic or paper-based, can significantly improve clarity and confidence during handoffs. Advanced care planning is also essential. By engaging residents and families in those discussions about goals of care, ideally during admission and the care conferences, staff can ensure that treatment decisions align with resident preferences. This not only reduces unwanted interventions, but also supports more personalized approach to care. Visual aids and decision guides can help facilitate these conversations and make them more accessible. Finally, it's important for staff to know their facility's capabilities. Understanding diagnostics, treatments, and protocols are available on site allows teams to manage conditions safely without transferring residents. Educating staff on resources and creating quick reference guides for common conditions such as UTIs, CHF, and pneumonia can empower them to make confident, informed decisions. Together, these strategies form a practical toolkit for reducing unnecessary hospitalizations and enhancing resident-centered care and long-term care settings. Together, we have the power to reduce avoidable hospitalizations and truly enhance the lives of residents we take care of. Your role is essential, and the steps you take each day make a meaningful difference. To help reinforce what you've learned, I'll be sharing weekly Did You Know messages, quick, insightful facts designed to keep these concepts fresh and actionable. After the final message, you'll be invited to complete a post-test to reflect on your learning and measure progress. Then, in 3 months, I'll follow up with a brief questionnaire to assess how these practices have been integrated into your daily work and gather feedback for continued improvement. Thank you for your commitment to quality care and for being a part of this important initiative.